According to the CDC, about half of men in the U.S. who die suddenly of heart disease have no previous symptoms. Dr. Sam Turner, an interventional cardiologist with Novant Health, joins us now to talk more about the factors that can increase a man's risk of heart disease. Thank you for joining us. We appreciate you.
Thanks for having me.
All right, so let's begin with coronary heart disease. What does that mean?
So coronary heart disease is when a fatty substance called a plaque builds up inside the heart arteries. Now, the coronary arteries are the arteries that supply the blood flow to the heart muscle, which gives it its oxygen that it needs. So as these plaques develop, the coronaries become smaller, they become hard and narrow, and this reduces the blood flow to the heart muscle. And when that happens, patients will have symptoms of chest pain, heart attack, and sometimes sudden cardiac death.
All right, sounds like trouble to me.
Mm-hmm.
All right, so talk to us about some of the things men can do to lower their risk of heart disease.
That's a great question. So some of the simple things are to maintain a healthy weight, avoid smoking, and do routine exercise. You know, a lot of men think there's no point to moderate exercise, but that's not true. Moderate exercise, such as just 30 minutes a day, 5 days per week, can significantly decrease your risk of heart disease. It's also important to get your cholesterol checked every year, and if your cholesterol is elevated, you should talk with your doctor about starting one of the statin medications in addition to routine lifestyle modification.
Now, I've been curious about this one. Does belly fat have anything to do with any of it?
Well, all fat is can put you at risk for heart disease, so maintaining a low body weight is important.
All right, what about family history? Does that affect the risk factors?
Family history is very important as well. So if you have a first-degree relative, your mom, dad, brother, or sister, if they've had a heart attack before the age of 55, you're at risk for heart disease. But as we mentioned, heart disease is more of a lifestyle disease. And so just because you have a family history, it doesn't mean that you're gonna have heart disease. It just means you need to take those steps to prevent it.
All right, what other kind of good stuff you can tell men?
I think the most important thing is to see your primary care doctor at least once a year, and at that visit, make sure you know what your blood pressure is and your cholesterol is, and make sure they review all the medications that you're taking, and that'll help your doctor and you make a good plan for the changes that you need to make.
And to get more information?
You can visit our website at novanthealth.org/heart to find more information or a provider.
All right, good stuff. Thank you so much. We appreciate it.
Thank you.